Alameda County is a very diverse county. We have disparities in health, we have poverty, we have housing issues, and there are several ethnicities that have higher rates of diabetes. 2 years ago, we were fortunate enough to receive a grant from the Merck Foundation called Bridging the Gap. And it allowed us to bring partners together in the community to enhance our ability to serve people with diabetes. We started by partnering with a couple of clinics in our area, one being Roots, which is serving our East Oakland area, which was an important area for us to reach out to.
Alameda County Public Health Department identified areas of the county that had the highest burden of uncontrolled diabetes, and East Oakland was one of those locations. The partnership with the Public Health Department is really key because of their handle on both the data and also on self-management interventions and approaches to managing diabetes. And what we love about it is that Roots really sort of embraces an empowerment approach.
This program is unique because we are working with community clinics to become more responsible for teaching diabetes classes to their own patients. They can give them a diabetes education. They can introduce them to cooking classes. We've done coordination of care by actually training the clinics on how to have peer educators teach diabetes classes, and we've supplied them with the curriculum needed to teach these classes.
One of the most important things that I think we have here are what we call navigators, and navigators are the largest job class at Roots. Navigators are people from the community that we hire and train as community health outreach workers and health coaches.
As a health navigator, your job is to navigate the person through all the resources that are available at Roots. We find that, okay, what do you know about diabetes? What do you know about maintaining how to live with diabetes? And being a peer-to-peer instructor cuts down a lot of barriers. You can say a person can relate to you, and by relating to you, they're more perceptive to hear what you're saying, and by it being a more relaxed environment, it helps the education that you're teaching to sink in.
I was diagnosed with diabetes about 8 years ago. This is where I came because I wasn't getting no services or no help nowhere else. Then taking these classes, diabetes classes, helped me understand more about my diabetes and how to control it. If it wouldn't have been for this class, I would have never, I don't think I would have made it because my diabetes was really bad. Basically, coming to Roots saved my life.
We're paying more attention to social determinants of health through this program, which is somewhat different than what we've done before. We've always been a department that looks at that, but we're also looking at physical activity and food access, which we haven't done previously.
We have what we call Roots Community Market, and it's basically free food, so it is like a food pantry, but we distribute food using a point system. So that people can receive nutritious food in a non-stigmatized way.
People, they talk about how eating healthy is expensive. So yet we learned how to use the food pantry food, and then we had the cooking class. So that we're giving you food that we've taught you how to cook healthy with.
Bridging the Gap has also allowed us to bring physical activity directly to a clinic, and in the case of Roots, they had identified wanting to walk in the parks. So we are taking patients for walks in the regional parks here. We started by partnering with Samuel Merritt University, and so their second-year physical therapy students are leading our walks. They come, they have a good time, they make new friends, and they learn of new places they can go to with their families.
Bridging the Gap has also given us enough flexibility to say whatever our community needs in order to do better as it relates to diabetes, that those are things that we can implement. We all recognize that poverty itself is one of the reasons for poor health outcomes. And so not only do people walk in here to Roots, but we're also delivering care in the streets and the encampments. And so the fact that we've been able to incorporate addressing that particular social determinant of health through this opportunity has been really powerful.
We help out in any way we can. So we have people come that might need assistance with housing. Maybe they might need assistance with maybe paying their electrical bill. And maybe might just need some type of assistance with clinic, be seen. So our doors are open for people of all walks of nature that need some type of assistance that we have here to provide.
I see Alameda County's role in the future with this type of a program teaching more of the clinics how to do this same thing. We have several community clinics in our county, and I'd love to see more people do this.